Did you know that children can be affected with cancer? Yes, a child from 1 year, from 6 months, from 2 years, from 3 years can be diagnosed with cancer. Hey, welcome back to my YouTube channel. How are you all doing? Hope you're well, hope you're fine. How was the weekend? Thank you for subscribing. Thank you. So, on today's episode, we will be talking about childhood cancer. Cancer in children. That is what childhood cancer actually means. So let's define childhood cancer in the first place. Childhood cancer are also called pediatric cancer. It is generally a term used to describe the range of cancer that happens to children. Yes, and I've heard people say, so children also have cancers. Yes, they do. There are different types of cancer for children. We have the osteosarcoma, that is the bone cancer. We have the brain cancer or the brainstem tumor. We have the IPG, that is a type of brainstem cancer. We have leukemia, blood cancer. We have lymphoma, that is Hodgkin's or non-Hodgkin's cancer. We have neuroblastoma, that is from the nerve cancer. We have retinoblastoma, that is eye cancer. We have sarcoma, soft tissue cancer. We have spinal cord tumors, and we have wheel tumor cancer, that is kidney tumor. What are those signs and symptoms for cancer you should look out for? Because childhood cancer do not have those visible kinds of signs and symptoms when it comes to the kinds for adults. Childhood cancer, some of them are not visible. There are just few of them that are visible. So let's talk about some of the signs and symptoms. But before we talk about the signs and symptoms for cancer, this is sponsored by Untold Story Behind the Story Foundation. Thank you for your sponsorship. Thank you for always pushing. This is their notebook, and they have the write-ups of how childhood cancer is, what the definition, the signs and symptoms, prevention, and all those things. So let's talk about those visible signs and symptoms. We have actual swelling or lumps. We have unexpected paleness and loss of energy, easy bruise or bleeding, and ongoing pain in one area of the body. We have the limping. We have unexpected fever or illness that does not go away. Those kind of illness that you treat today, you treat tomorrow, it doesn't go away. It is time for you to take your child to the hospital. Do stop going to the pharmacy. If you have treated once, you have treated twice, what are you waiting for? Even when you are treating once, go to the hospital. Childhood cancer, early diagnosis is always the key to prevention. Childhood cancer is not death sentence, except that the child is being diagnosed late. I have seen a lot of cases, a lot of late presentation, which actually led to death rates. So when people hear cancer, they think it's death rate. No, late presentation is always a problem. So do not present your child late for diagnosis, because when you bring your child to the hospital, investigations are going to be done. Doctors are going to conduct their own investigations. They will not just diagnose immediately. A lot of things will have to go in before an actual diagnosis, and the more you delay, the more the cancer will keep spreading in the body. So other signs and symptoms is frequent headache, often with vomiting, then sudden eye or visual change. Yes, I had a friend whose child was diagnosed with retinoblastoma, and thank God she caught it early, because she noticed a change in the eyes of her child. Right now, her child is living well and alive because it was caught early. Then sudden unexplained weight loss. All those things are signs and symptoms to look out for when it comes to childhood cancer. So I hope this video has been able to educate you a bit on childhood cancer and those things to look out for. Again, September is Childhood Cancer Awareness Month. Thank you to Untold Story Behind the Story Foundation for the sponsorship. This video has been able to educate you. Until we see next time, have a good week. Bye.